I'm Dr. Christopher Barker, and welcome to Holding Space. Today, you're going to have to hold space for me because it's going to be kind of a wide-ranging topic. Trigger warning, it's going to be about trigger warnings and also about language experiences. I'm going to be referring at some point to an article in the Journal of Experimental Psychology Applied, and I'll get back to that in a moment. But first of all, what does trigger warning mean? The word trigger itself has connotations. A lot of people will, and it's kind of become something I'm hearing more and more often lately, people saying that they're triggered. And triggered is an interesting word because it sort of indicates that something has set you off. It has created a chain of or a singular, either behavioral, emotional, or both event. Language is affected, sense of well-being is affected, sense of security is affected. One can be triggered to just about anything. One can be triggered to anger. One can be triggered to depression. One can be triggered to harmful thoughts. But think about the meaning of these words. And I refer back to a Harvard psychologist, Leston Havens, who did a lot of work with language and psychotherapy. And I found all of this very interesting because what the words that we mean, sometimes it seems really picky to go back and say, hey, you use this particular word, but they have connotations. And especially if we have a shared experience of language, if you are talking to someone who is not speaking the language that you grew up hearing, if it's not your native tongue, you will not necessarily have the same experience with language that the other person who is speaking has. So that's something that, again, you have to check things out and see, does that mean this to you? What does that mean to you? We always have to check because just because we all speak English, there are also dialectical differences. I remember when I was, a few years back, I said something of, because I was originally raised in the southern part of the United States. Not very southern, but sort of thought it was. But my grandmother, who was from Appalachia, used the term hosepipe to refer to a garden hose. And I remember I said something to a friend of mine about the hosepipe, and they're like, the what? I said, the thing you spray water with, you mean a hose? And I was a little floored to realize that all this time I'd been using a word that really didn't mean the same thing to me that it meant to everybody else, or maybe they'd never even heard that word. So sometimes we have to check these things out. And sometimes the words that we use carry a meaning. I think the term triggered actually is a little overused. And I think sometimes it's better to be able to say, I feel this about what you said, instead of just, I'm triggered, which can be triggering to the other person just to hear that word, because it carries a connotation that they did something wrong. They pulled a trigger on you. And different people recover from triggering at different times. I mean, when you think about pulling a trigger, it only takes a second, although the damage done can be devastating. You can be devastated by a verbal trigger or an emotional trigger to someone also. But what really makes it difficult is that people sustain their reaction for different periods of time. Some people will react instantaneously and it's over with, and they'll say, hey, but that just triggered a reaction in me. You can talk it out, you can work it out. Some people don't have full awareness of what it is that is being triggered, and they will start behaving in a strange way, or they will start having an emotional reaction that they can't explain. Oftentimes it will get assigned to the person who has done the triggering, and it will be something that is seen as being something that the person did wrong, and perhaps deliberately. And a lot of that is based on experience and subconscious meaning. And again, a lot of words have subconscious meaning. We tend to see words that are negative as something sometimes that have become so worn into us that it's the only thing that we can speak of. And sometimes I was talking to a colleague of mine about doing narrative therapy. And one trick for that is to talk about yourself in the third person. So you can say, Chris was born in the South. He grew up there. And by talking about yourself in the third person, you are removing some of the emotional connotations from it. It's very easy once you're talking about I did this and I did that to become sort of lost in the narrative. But when you're talking about yourself in the third person, sometimes the story becomes clearer and you see yourself from a different perspective, sometimes having an awareness of yourself that you did not have before when you're totally inside your head talking about I. It's an interesting perspective, and I think something that we have to take a look at in terms of what does emotional meaning mean? What is the effect of emotional meaning? The study that I referred to earlier took a look at the words trigger warning and safe space. Specifically, they used a university population. They showed a film of a professor talking about saying, I'm going to introduce a trauma topic. And there were different conditions of the experiment. There was one where the professor would say, trigger warning, this is going to be difficult to hear. Another one said, this is a safe space, but this may be a difficult topic to hear about. Sometimes they use both, sometimes they use neither. It was generally found, that's called a controlled condition, by the way, for those of you who are not experimental psychologists. I sometimes forget that not everybody is. But anyway, what we have is a result of people who use the word trigger warning. It had virtually no effect. The students reported feeling no different about the topic than they would have in any other condition. However, safe space did produce a feeling of security. Also, it was seen as being liberal and left-leaning, and I think this reflects some of what we're experiencing in the world today, where there is a big reaction toward the word woke. And that is something that a lot of people feel very negatively about. A lot of people feel very positively about. In any case, it is kind of a trigger word. And what it often creates is a sensation of something about the person who says it. You can feel that they are using terms like safe space. Well, that's something that originally maybe came from substance abuse counselors, but it's been seen as something that's sort of emerged as sort of a, I don't know, to quote George Carlin, sort of a hippy dippy word. It's not anything but a word. It is a concept, however, and it is essentially the same concept as trigger warning. Safe space, however, gives a connotation that this place is okay. This place is safe. You will not come to harm here. Trigger warning is more like, oh, brace yourself. And I think the connotations of it are entirely different. I'm surprised that they didn't explore that in more depth. Maybe they did. I have to read the whole article. I just read a summary of it in Monitor on Psychology, the APA monitor, which is, a good summary, but nonetheless, I think sometimes the whole article tells you a whole lot more. If anybody wants to look it up, please feel free. They don't even give the name of the authors. That's terrible. Anyhow, the concepts are the same, regardless of whoever wrote this, regardless of whoever studied this. It's about language, and it's about the meanings that we have of language. The use of metaphor, for instance, requires shared meaning. If we say something about John is a weasel, to some people that that creates sort of like I don't know what that means, but I think to most people, it implies sort of a slippery, devious character. Weasels are not necessarily devious, but, they are animals. But again, that is the meaning that it's been sort of assigned. And once we have a meaning in our vocabulary, once it becomes part of our lexicon, we tend to look back on that word over and over again as having a particular meaning until something changes our mind. And recalling my earlier podcast on confirmation bias, we don't necessarily have our minds changed very easily. So once a word has a particular meaning to you, it is going to probably keep that meaning. And it's only by active effort that it's going to change. Communication is really important. Asking someone, what do you mean by that? Or asking someone, what does that mean to you? What does that word mean to you? I do this very often with patients in my office. I'll say, but wait a minute, you use this word. What does that really mean to you? And sometimes it's good to go back and really pick those things apart because things can be distorted. Things can become shorthand. Things can become idiosyncratic to that person. And idiosyncratic means it has meaning only to that particular person. But by having meaning to that person and they try to convey it to you, you may not pick it up. You may have an entirely different interpretation. So I guess what I'm trying to say is try to communicate, try to hold space for the other person. I don't know, maybe that sounds a little liberal also, but it's your words. The words have meaning and words carry effect. Keep that in mind, something to think over, and we'll talk about it again at some point, I'm sure. Words are really an important part of what we do, and they are a big part of communication. This is Dr. Christopher Barker. Hit like, subscribe. Feel free to comment. I do get back to comments as often as I can. Feel free to email, and I hope to see you again here at Holding Space. Thanks.